something, ensuring that the complete or total number of students who joined Form 1 sit for their KCSE exams after 4 years is another. This is after at least 275 students who joined Form 1 4 years ago did not sit for the KCSE exams last year. Food for thought. Now on to matters health now, and the Kenya Union of Clinical Officers and the Kenya Clinical Officers Association have today registered their dissatisfaction with the newly approved organizational structure for State Department of Health. The unions further decried what they termed as deliberate frustration of career progression in the ministry, while calling on the Public Service Commission and the ministry to recall the said structure over failure to follow established procedures.
The two clinical officers unions today, during a press conference at their headquarters in the capital Nairobi, expressed their dissatisfaction with the new organizational structure for medical services, lamenting over what they termed as discrimination and exclusion of clinical officers, with the process having not undergone public participation.
We wish to register our collective protest and objection regarding the recent approved organizational structure. Regrettably, our scrutiny of the approved structure reveals a direct and concerning discrimination of clinical officers in regard to the directorate establishment and key position within the specified state departments. The organizational structure was developed without public participation as provided for in the Constitution. 2. Clinical officers were never involved in the development of this organogram and the staff establishment.
The union leaders, while decrying the decision to have new structures without consultations, called upon the Ministry of Health to suspend the new structures, as it will also affect the implementation of the universal health coverage.
Failure to address these existing disparities will result in direct exclusion of clinical officers from decision-making process, hindering career progression and posing potential crisis in the implementation of UHC at all levels. We foresee a potential repercussion on service delivery, given the displacement of clinical officers from key position and program, further impeding the realization of the universal health coverage.
The unions called for dialogue while issuing demands to recall the new structure, including
the Ministry of Health immediately halt execution of the approved structure and staff establishment to facilitate comprehensive review of the said structure. Both the State Department and the Ministry of Health to immediately initiate stakeholders' participation. 3. Public Service Commission recalls the organizational structure and establishment to allow for an all-inclusive process.
They further issued a timeline for their concerns to be addressed, failure to which they will issue a way forward.
The union will utilize all redress mechanisms within the law if these demands are not addressed within the next 14 days without any further reference to the ministry.
Ian Keitani, Look Up TV.
That story was produced by one Nancy